I'm Dr. Chris Gordon here at Shriners Children's, Ohio, and I'm a pediatric plastic surgeon and craniofacial surgeon. So what that means is I'm a plastic surgeon who learned how to do all the normal stuff from facelifts to microsurgery, but then I did an additional couple of years, learned some very advanced techniques, including doing things like fetal cleft surgery, and there were new techniques for stretching jaws out, etc. And we brought some of that innovation here to Ohio, and we started tackling some of these bigger cases, kids with really complicated problems, ranging from things like Treacher-Collins syndrome, which is probably what you've heard of from the book or the TV movie Wonder, which is small jaws and absent ears and clefts of the eyelids, etc., to more complicated things like golden heart syndrome, where you're missing part or all of your jaw, or even things like Cruzon syndrome, Apert syndrome, Pfeiffer syndrome, where there's a mutation in a gene that tells the skull bones when to mature, so they mature too quickly. And basically what you see is a kid who has eyes bulging out of their head, tongue is sticking out of their mouth, they're gasping for air, their brain is being compressed because the skull is already fused closed and those expansion joints don't work anymore. And it can be a lethal condition. Certainly it can cause brain damage, it can cause terrible problems with heart and lungs and brain. And so these kids need urgent surgeries. This is sort of my life's work, is getting good at taking care of these kids. So for instance, I think to date, I'm the only guy who has done what's called a monoblock surgery, where you take the entire forehead, you go around the eyes and then behind the jaws and crack that whole thing loose and pull the face forward just with little endoscopes. So typically they would peel the scalp down and kind of do the surgery open, and I was able to figure out a way to do it through little keyholes and cameras and do all the surgery from inside out. Once we got good at this, we started getting referrals from all over the world, and then I got named to the board of the World Craniofacial Foundation. Now the word is out. So Apert syndrome, for instance, is one of the rarest, where they have all of the facial stuff, but they also have the hands where the fingers are fused together when they're born. And you might see one of those a year, one of those every couple of years in a normal, pretty busy craniofacial practice. And I think we have 5 of them currently undergoing treatment right now. These craniosynostosis syndromes that we sort of refer to, the doctors refer to as the FGF, are group of disorders where there's a mutation in the receptor for a growth factor called fibroblast growth factor, and it can cause this bone problem that we talked about. I personally think that all these kids have a normal potential intelligence, but what frequently happens, when you're living far away from medical resources, is that you can't get the kids treated quickly enough, and so your brain just doesn't tolerate being squeezed. Your eyes don't tolerate being squeezed. So these kids can, develop blindness, they can have strokes, they can have seizures, they can have hydrocephalus, and essentially be permanently delayed from having chronic pressure inside their head. The brain can get so squeezed that it actually gets sort of stuffed out of the bottom of the skull and into the spinal cord, and that can cause fluid to accumulate in the spinal cord. It's called a syrinx, and then these kids can have weakness, staggering gait. It can even affect the way your heart and lungs work because of the pacemaker activity in your brain. We've seen kids where we'll start off knowing that this kid has a really tight head. We'll go through little pinholes and crack the back of the head loose and either put in some distractors where the parents turn screws and make the head bigger like a taffy pull, or we put in springs that work by themselves and make a bunch more room. So we're averaging probably 20 to 30% more volume inside the skull in a few weeks. And a good example is our friend MJ, who basically was living with really chronic intracranial hypertension. And we did the skull surgery on him, and he said, "Dr. Lober, I want to tell you that my brain is working better now after you guys did this surgery on me." We started laughing because we thought he was kidding, and he said, "No, really. Before the surgery, I could only think of one thing at a time, but now I can think of many things at a time." So I think even the kids realize this is life-saving stuff. In a few weeks, you can completely get rid of all the stigma of the disease and essentially get to a pretty normal-looking kid. That's what we're shooting for, because these are really resource intensive. So if we have a kid who's coming from Fiji or a kid who's coming from Pakistan and they don't have any resources, we've been fortunate enough to be able to take care of them, soup to nuts, and get them fixed and send them home doing great, where that one case might break the bank in another center around the world, and we've been given the green light to go ahead and take care of these kids. So not just the rare one here in the United States, but we're seeing kids from literally all over the world, and now they're being referred to us from other doctors, and even other doctors who do these kinds of surgeries. We have surgeons who are as well trained as anybody in the world, great team here, great staff, great outcomes, and I think you're going to be hearing a lot more from us in the future.